In this class we are going to deal about the abdominal region. So this abdominal part, it is a area which is present between the two other areas, that is above will be having thoracic cavity and below part will be having pelvic cavity. So between the thoracic cavity and the pelvic cavity we have got this whole region as abdominal part, and this abdominal part in the front it is called as trunk, and the behind part, that is posterior aspect, we will call as back of the abdomen. So this is the back of the abdomen which we are seeing, and in the front we have got trunk of the abdomen, and this region it is occupied by the abdominal cavity. So this region, whole thing we will call as abdominal cavity, the abdomen which is stretching from the thoracic diaphragm above. So if we have this part, if we are dissecting and seeing, between the thoracic cavity and the abdominal part we have got thoracic diaphragm, and below part between the abdomen and the pelvic region we have got a pelvic brim. And we are now going to deal about the abdomen and pelvic organs structures together. So abdomen and pelvis are considered together in this session. So in abdomen, what we are seeing in the anterior aspect are the abdominal organs. So the part which we are viewing now is abdominal muscles which are forming the anterior abdominal wall. So this is the anterior abdominal wall part which we are going to dissect off. So if we dissect first muscle, what we dissected is external oblique abdominis, the muscle which is present in the anterior most aspect. After dissecting out skin, superficial fascia, we will be having the muscle called external oblique abdominis. So once you remove this muscle, you will have another muscle which is coming from lower aspect to the upper aspect. So this muscle we will call as internal oblique abdominis. So once you remove this internal oblique, the another muscle which is passing transversely on either side, so this muscle is considered as transverse abdominis muscle. So between the transverse abdominis and the internal oblique, in the upper part we have got a part of rectus abdominis muscle. As the name itself it indicates, rectus abdominis, it means the straight muscles. So this is rectus abdominis muscle. So we are removing rectus abdominis along with transverse abdominis muscle. So once you remove that, we are getting into a cavity called peritoneal cavity. So inside the abdominal wall muscles we are getting a cavity formed in the abdominal region, and this cavity is considered as abdominal cavity. This abdominal cavity is having peritoneum on the whole extent. So once you remove that peritoneum, we will be having that is a cavity which is filled with peritoneal fluid to keep the organs in position, and then we have got the abdominal organs. In that we are seeing peritoneal fold which is forming a apron shaped fold over the abdominal organs, and this fold is called as greater omentum. So once you remove that greater omentum, we can approach the abdominal organs very easily. So the loops which we are seeing here is loops of small intestine or coils of small intestine, which is comprised of duodenum, jejunum and ileum. And in the upper part we can make out the larger colon, that is we have large intestine. Here we have got cecum, appendix, and then it is going to continue upwards as ascending colon, and later it is going to form transverse colon, and later it is going to continue as descending colon, which again will continue as sigmoid, and then it is going to end up in rectum and anal canal. So we are removing the small intestine loops. So once you remove, we can approach the large intestine very clearly with all its parts. And now you can view some vessels present over there. That is, we have got abdominal aorta and inferior vena cava are the major vessels present here with their major vessel branches, which we will deal later. So once you see the upper aspect of these things, we can make out another organ present over here, and this organ we will call as liver. So this is the liver which is present in the upper aspect. So before going into the details of each organ separately, we will approach with the regions, how it is divided and how the organs are placed. So just orient yourself on organs, how it is placed in this image. So here we have got the thoracic wall muscles. So after removing the thoracic wall muscles in the upper part along with the cartilage and ribs, we can make out the muscles, that is intercostal muscles. So once you remove this intercostal muscles also, we can approach the larger muscle which is forming a dome shape above the abdominal organs. So this muscle we will consider as diaphragm. So this is a muscle we call as diaphragm, from where we have got abdominal wall or abdominal region extending below this thoracic diaphragm. So if you remove this thoracic diaphragm, you can approach the organs clearly. So we can see the liver over here, and then after we have got here this part, we are going to remove the other thoracic wall muscles along with the ribs. So once we remove all these things, we can see the structures more easily. So here we can see the another important organ on the left side, that is spleen. So we can approach this clearly. So anterior aspect we had seen liver, and in the left side we had seen another organ called spleen, and then after we have got stomach, which is forming the digestive, one among the digestive tube. So major organs present in abdomen region are the digestive system. So we have got tubes and solid organs present all over the abdominal region. So in that we had seen solid organs such as liver and spleen, and then we have got digestive tube which is extending from esophagus, then after continuing as stomach, later it is going to continue as duodenum. So after it is going to continue as duodenum, it is going to enter as ileum, jejunum, and then it is going to continue as the large intestine. So here we can make out this is gallbladder. So once you remove this liver, we can make out the other organs also clearly. So these are the vessels which are supplying the abdominal organs, which we will deal about all these things later detailing. So now once you remove gallbladder, you can make out the duodenal part. So this is the esophageal part of stomach, and then after we have got stomach here, then we have got continuation of stomach as duodenum, and then it is going to continue here where we had removed the coils of small intestine such as ileum and jejunum, and here we have got cecum with appendix. So this is the appendicular part, this is cecum part with ascending colon, and this is transverse colon. This is transverse colon, and here we have got the descending colon, and then it is going to continue as sigmoid colon. Later it is going to continue as rectum and anal canal. So here we will be having rectum along with anal canal. So in that way it is going to continue. So now we are having other organs which are present behind the peritoneal fold. Some organs which we are seeing in abdomen are fully covered with peritoneum, and some more organs it is covered only on the anterior aspect, and those organs are considered as retroperitoneal organs. So if you remove that peritoneal part in the anterior aspect, we can make out the other organs such as kidney, which I will show you in posterior view. So it will be clearer. So in the posterior view, if you are seeing, so we are removing the muscles in the posterior aspect. So in the back muscles we are removing. So once you remove the back muscles along with the ribs, you can approach the posterior abdominal wall organs, such as after the muscles we have got organs which is present over here. So this is the kidney. Both left and right kidney will be seen on either side along with the suprarenal gland above it. So this is kidney along with the suprarenal gland. So these are the structures or organs present inside the abdomen which we are going to deal detailedly in our upcoming class. So in the abdomen class sessions we are going to deal about inguinal canal, abdominal aorta, portal vein, liver, spleen, pancreas, stomach, And then we are going to deal about the pelvic organs such as urinary bladder, rectum, uterus, all these things in a detailed account. So we will get into the details clearly. Before going to the details, I have to tell some details about the abdominal muscles which are present in the anterior aspect. So abdomen region, if we are seeing, as we discussed before, it is the part of the trunk below the thoracic diaphragm, and this cavity again we will divide by means of pelvic inlet into two parts, such as upper part we will call as abdomen proper and the lower part is called as pelvis. And then we have got in the abdomen region, again we have got around 9 regions which are again divided by two planes, such as two horizontal planes and two vertical planes. So those details we will deal now. So planes, as I said, we have got horizontal planes and vertical planes. The horizontal planes are such as transpyloric plane and transtubercle plane. This transpyloric plane, it will pass on the level of tubercles. Transpyloric plane, it is passing at the level of pylorus of stomach. So we are calling it as transpyloric plane at the level of L1 vertebra. And then we have got transtubercle planes which is passing at the level of tubercle of ileum. We are having at the level of L4. And then we have got vertical planes which are again right and left, which is passing through the mid-clavicular line from anterior superior iliac spine, and between the anterior superior iliac spine and pubic symphysis. So the abdominal quadrants we can divide as right upper, left upper and right lower and left lower. Into regions, we have got 9 regions. This is very important for understanding the organs placement, such as we have got 9 regions. In the upper 3 regions, we have got right hypochondriac, epigastric and left hypochondriac. Hypochondriac means below the cartilages. So here we have got the ribs, such as thoracic ribs. Below that we have got this region, so we are calling it as right hypochondriac. And epigastric means above the umbilical region. So we have got epigastric region, and then we have got left hypochondriac region. Then we have got in the middle part 3 regions again, that is right lumbar region, as it is related to the lumbar vertebrae right and left. And then in the middle part we have got umbilical region. Below that we have got ileum on either side. So in the iliac part we have got right and left iliac region. Between we have got below the stomach part, so we are calling it as hypogastric region. So this is how abdominal wall muscles will be viewed. So anterior abdominal wall boundaries, if we are taking, we have got above bounded by xiphisternum in the middle part and right and left costal margins on either side, and below it is bounded by anterior part of iliac crest and a fold of groin along with pubic tubercle, pubic crest and pubic symphysis. The side walls are formed by downward prolongation of mid-axillary line. So this is how the abdominal regions are divided. The 9 regions we can view: hypochondriac on right and left, epigastric region which is carrying liver, stomach and spleen, and then we have got right and left lumbar region and umbilical region which is going to hold ascending colon, transverse colon along with the coils of small intestine. Below part we have got right iliac, left iliac and hypogastric region. We have got cecum, some coils of small intestine along with sigmoid colon. So anterior abdominal wall layers, as we discussed, we have got first skin and then superficial fascia. Then we have got external oblique muscle with its aponeurosis. Then we have got internal oblique and aponeurosis. Later we have got transverse abdominis with its aponeurosis and fascia called fascia transversalis with a fat tissue called extraperitoneal tissue, and below that we have got parietal peritoneum. The deep fascia is absent in the anterior abdominal wall. The superficial fascia, again we will divide into 2 layers. One is superficial fatty layer and then one is deep membranous layer. The superficial fatty layer is otherwise known as campus. Deep membranous layer is called as scarpa's fascia. The fascia of campus is nothing but it is continuous with subcutaneous fat of the adjoining area. In scrotum it is replaced by dartus muscle. Fascia scarpa, it is a modification. In the midline it is going to continue in front of pubic symphysis as fundiform ligament of penis over the pubic crust it is going to continue with the dartus muscle, hence with the fascia collis of the perineum. So you will understand this while we are dealing with perineum part. And over the inguinal ligament it bends with the Holton's line. So this is how muscles are arranged as we discussed before. And external oblique muscle, these fibers, it is passing from above downwards, 8 fleshy fibers, and then it is going to end up forming a broad aponeurosis. And this is how external oblique muscle will be seen. And insertion, it is going to happen in the midline part, that is from xiphoid process to the pubic symphysis over here, and it is going to get its extent till the pubic crust and pectineal line of the pubis, and nerve supply will be lower 6 thoracic nerves. And then we are going to deal about internal oblique muscle. So internal oblique origin, again these muscles are coming from below upwards. It is taking its origin from lateral 2/3 of inguinal ligament which is present over here, and then anterior 2/3 of intermediate area of iliac crust, and then behind we have got thoracolumbar fascia. Insertion, it is also same like external oblique. Again it is getting inserted into xiphoid process, pubic crust and pectineal line. Along with that it is getting inserted into uppermost fibers of the internal oblique, getting inserted into lower 3 or 4 ribs with their cartilages. The special features we will deal later along with the other parts. So I am just rushing up to the transverse abdominis muscle. So transverse abdominis, as the name indicates, it are transverse fibers will be seen. It is taking its origin from lateral 1/3 of the inguinal ligament and anterior 2/3 of the inner lip of the iliac crust along with thoracolumbar fascia, and then it is going to take origin from lower 6 costal cartilages. Horizontally forwards it is going, and this is how transverse abdominis is seen. And insertion, it is again to the xiphoid process till the pubic symphysis and the pectineal line, and then it is going to fuse with the internal oblique muscle to form a conjoint tendon that we will deal with inguinal canal. So action of all these muscles is mainly for supporting the abdominal viscera which is present inside, and it is effective during impulsive acts such as micturition, defecation, parturition and vomiting, and also during forceful expiratory acts such as coughing, sneezing, blowing and shouting. And other actions are movements of the trunk, that is forward flexion and lateral flexion and rotation of the trunk. So this is how muscles are arranged in a transverse section. So if you take a transverse section, rectus abdominis which is present anteriorly, on lateral side we have got 3 muscles, outer to inner, external, middle, that is internal, and then we have got transverse abdominis which are arranged in such a way, and along with the vertebra we have got posteriorly psoas major muscle along with quadratus lumborum. So these all about the basic details of abdomen. We are going to deal about the details of each organ separately. As I said, we are going to deal about liver, pancreas, and then we are going to see about portal vein, abdominal aorta, along with inguinal canal, and also we are going to deal with pelvic organs such as urinary bladder, uterus, perineum, and then we are going to deal about anal canal.